sobering. We'll pass straight on to Maxine. Maxine Molyneux, as I'm sure many of you know, is Professor of Sociology and Director of the Institute for the Study of the Americas at the University of London. She's written extensively in the fields of political sociology, gender and development, human rights and social policy, and has authored books on Latin America, Ethiopia and South Yemen. Perhaps we should move. Do you want to stand?
I don't
Or
mind.
Shall I move over here?
I mean, it's only a few slides for purposes of illustration, really, so it's not a
Okay.
big problem. If it doesn't work, it's not a huge loss.
Okay. Whilst we're setting that up, Maxine's current research is on social protection, rights and citizenship, and the link between economic and social policy in Latin America. So we've asked her to speak on the new frontiers in relation to economic and social empowerment of women.
Thank you very much. Yes, the question of jobs half done, which Ms. Molyneux raised, glass is half full, half empty. We have to be positive and think of the good things, but we also have to think quite carefully about what is being ignored in the current development agendas. And I'm afraid that one of the areas that one sees need for much more discussion about gender issues is in social protection. And it's all the more urgent because social protection is actually now being seen as a major area that all IFIs, donors and governments are united in wanting to see progress on. So one hopes that impulse will give some broader discussion to what needs to be done to make these much more effective than hitherto they have been. So what I want to do in this brief talk is to offer some reflections on some research findings from Latin America that we've just been working on to cast light on whether the poorest in developing countries are making progress towards the MDG goals concerning the eradication of extreme poverty, but also the reduction of maternal mortality and the empowerment and equality of women. So on the basis of research that I and others have been carrying out in the Andean region of Latin America, in Peru, Ecuador and Bolivia for the CARE International, I'm afraid that the answer is not terribly positive, and although we're meant to be considering the advances, here I'm afraid I'm going to be focusing on some of the gaps. The answer to that question of is enough being done is not enough, and this is despite the fact that there is definitely a positive story of progress in the Latin American region regarding poverty reduction in recent years, and regarding progress in women's equality. So there have been some good things happening. A report just published by CEPAL has shown that poverty has fallen in 12 Latin American countries as a result of two things: the commodity export boom, which has been a good thing for many countries in the region, including Peru and Bolivia, and also a major contributory factor in this reduction of poverty is the extension across the region of cash transfer programs. So the question is really, how far has this poverty reduction initiative actually reached poor or the poorest women? And of course, what we were looking at in this region of Latin America was the very poorest, which are meant to be targeted by the cash transfer programs, as you all know. Now, as a result of accumulated policy experience and debate, we know a fair amount about the causes and consequences of poverty and vulnerability. And among the lessons learned is that gender matters in tackling poverty, and that gender-sensitive programs are much more effective than those that are gender-blind. We also know that relieving poverty does not necessarily tackle women's gendered vulnerabilities. Higher incomes do not always mean that household resources will be evenly shared. You do need to have a gender-aware policy, you do need to have a gender analysis of these initiatives in order to understand those processes. Social protection instruments aim to reduce poverty and vulnerability through three kinds of initiative: social assistance, i.e. safety nets, social insurance, and inclusion measures. But despite the proliferation of innovative anti-poverty programs across the world, there remains a surprising insensitivity to gender-based vulnerability. The ODI has done a very good report on this, and I urge you all to read it. Now, this is somewhat at odds with the fact that international development agencies and many governments have endorsed the principles of gender equality and women's empowerment and claim to have made efforts to mainstream them. Latin American governments, often under pressure from active women's movements, some time ago domesticated international frameworks such as CEDAW and the Beijing Platform of Action, and they have since adopted measures aimed at securing female empowerment in various spheres of social action. There are quotas to enhance parliamentary representation, there are equality legislation to reform archaic family codes, and there are programs and laws designed to tackle violence against women, and many other things that have been done to tackle gender inequality. At the same time, there's been considerable progress in the area of indigenous rights, and the Andean region is notable for the considerable activism on these issues, both by indigenous communities and by governments in recent years, notably in Bolivia and in Ecuador. Now, while there's a growing concern in development policy communities to move beyond mere poverty alleviation to tackle the causes of risk and vulnerability, programs still fail to address or only partially address the needs and risks of vulnerable women. Yet if the targets set by the Millennium Development Goals concerning women's empowerment and gender equity are to be met, then developing countries, donors and development agencies will need to improve the design of anti-poverty programs to make them much more gender aware. Now, our research for Care International was on one of the most favoured instruments for tackling poverty, that is the conditional cash transfer. Favoured because they're effective and they're affordable ways for countries to reach the most vulnerable. CCTs are non-contributory government programs that combine income support for the poorest households, generally those who have no other forms of insurance, with human development goals. They're designed essentially to encourage children to get into school and to take greater care of health issues, and thereby try to avoid the intergenerational transmission of poverty through measures to improve education access and nutrition of children, as well as offering some kind of maternal health program as well, so that women get checks in the early years after pregnancy and during pregnancy. So the receipt of the cash transfers is made conditional on children's regular attendance at school and regular checkups at health clinics. Latin America tends to favour conditionalities, whereas, of course, in other parts of the world, notably Africa, it's harder to make them work. There's also, as you know, considerable debate about whether they're really necessary. But certainly the model that's been pioneered in Latin America, Brazil and Mexico in particular, and then was extended to the region, has tended to be interested in maintaining the conditionalities. So what we see is this model effectively now being put in place in most countries in Latin America and indeed spreading to other parts of the world, with the exception of the conditionalities. Now, the current policy emphasis on CCTs is widely debated. Few could fail to welcome attempts to reduce poverty, but there are quite a lot of concerns over the design, the sustainability, and the potential political instrumentality of the new programs. In the region, critics see these programs as assistentialist, that is, they only offer handouts to the poor and offer few exit strategies. Although a few programs such as Chile Solidario and some pilot projects in Mexico linked to the Oportunidades program have begun to incorporate elements that help to provide beneficiaries with exit strategies through training, through access to labour markets, through all sorts of other initiatives. Now, it remains an open question, however, whether the new forms of social assistance that will come will stay locked into or revert back to these perhaps more negative tendencies that are associated with CCTs, clientelism, short-termism, simply being ineffective in tackling the roots of poverty, or maybe they'll evolve into non-discretionary rights-based poverty eradication programs that can lift people in a sustainable way out of poverty. Certainly, current policy debate in Latin America, as elsewhere, is centering today on how to move beyond project-level initiatives to develop government-coordinated social protection programmes which over time will provide a much more satisfactory and integrated and effective policy response to poverty, exclusion and vulnerability. Now, while there is a lively debate over the adequacy or otherwise of cash transfer projects, it's so far taken relatively little account of the debate over gender and household impacts. As far as I know, no gender impact assessments have ever been carried out prior to these programs being rolled out in Latin America, and indeed very few evaluations examine this issue. We do know that CCTs are successful in meeting their core objectives. Children's attendance at school has risen, along with their nutritional levels, and households do appear to be more capable of managing risks, thanks to the usually small subsidy. Regarding gender, one positive design feature of these programs is that the transfer is given directly to the mothers, but mothers are also charged with ensuring that conditionalities are met. These programs give mothers exclusive responsibility for carrying out the tasks assigned, and all the activities of the program centre on the motherhood role. They take little account in general of women's other activities in the subsistence and market economies. In our research in this region, we found that none of the three programs that we researched in Peru, Ecuador and Bolivia had any equality or empowerment elements for women beneficiaries. And further, most of their particular needs that the women expressed, we interviewed 250 people and asked them what their needs were, and in very, very few cases did they feel that their needs were addressed. The women were essentially therefore treated in the programs as the means to fulfill the program goals. Now, as far as general progress for women is concerned, there have been, of course, many improvements in recent decades, and Glenys Kinnock did refer to these in a more general global sense, and that is also true of the Latin American region. But there are still considerable gaps in income, health, and in particularly severe gaps in the poor and marginalized indigenous and Afro-Ecuadorian communities that our research analyzed. Here you find maternal mortality and morbidity rates are highest, and female income and life chances are typically less than men's of comparable socioeconomic status. You even find an inverse ratio in education. That's to say that we've seen that females are actually outpacing males in education these days in many parts of Latin America. But in these regions, it's the other way around. Men's education or boys' education levels are still higher than women's. Now, in addition to long-term insecurity caused by low income, low asset accumulation, and in Ecuador and Bolivia, high rates of male outmigration, girls and women are also vulnerable to the effects of early and multiple pregnancies, and also high levels of domestic violence. Our respondents also indicated that they suffered in a number of ways from their very limited exercise of sexual and reproductive rights, evidenced in high adolescent pregnancy rates, the very high fertility levels, unwanted pregnancies, a product in part of the lack of information available to them on contraception and the lack of preventative health measures in general offered in the regions we were analysing. Even in cases where these services were being introduced, this was often done without adequate information being given to the women concerned so that they could make informed decisions. Only one program, the Juntos of Peru, had any kind of participatory mechanism, a system called Madres Comunitarias, which allowed beneficiaries to register their needs and complaints. None of these programs were connected up to other women's services or with women's organizations. No training of any kind except in childcare was offered to the women, most of whom were active in the subsistence economy. In addition, as the women pointed out, the conditionalities of these programs made increased demands on women's time, which they felt was in general not valued, and thus further limiting their economic endeavors. Now, with the rising cost of food, household survival has come to depend increasingly on the incomes that women can generate. So the consequences of reinforcing women's role in the care economy may be to restrict their ability to develop their own resilience to poverty and their participating in the labour market. They do little, in other words, these programs, to allow women to actually maintain a differentiated set of roles by placing so much emphasis on this motherhood role, which of course is very valuable and very important. But it does mean that the transformative potential of the programs to provide poor households with greater resilience and ultimately the means to escape poverty is severely limited. The main aspect, of course, of the program that participants most appreciated was, not surprisingly, their receipt of the transfers. Who wouldn't be appreciative of having a bit more money? This made them less dependent on husbands for money to meet the basic costs of children's daily needs. They also appreciated their increased decision-making power, which gave them greater self-confidence overall. And this was the element that is usually identified as the empowering elements of the program. I would say that it is important, but it is really empowerment light if it doesn't actually come along with any other means to get women out of the poverty that they're in, other than giving them a small stipend. And of course, the problem we go back to is how can these programs help to tackle the enormous range of gender-specific vulnerabilities that women suffer for, I mean, including, of course, very precarious employment and income-generating opportunities, but also domestic violence, a series of reproductive health risks. One can see that if only gender equality and women's empowerment were to be mainstreamed into social protection programs, elements could easily be, and we identified many areas that these programs, without spending too much more money, and could be much more gender responsive and really much more helpful to women, that would actually help to enhance women's capabilities and advance knowledge of the rights that they have been given in the new constitutions, in the various frameworks that governments have adopted. In other words, women's empowerment implies more than simply acquiring control over a small subsidy. It also implies tackling gender inequalities in the home and in the society at large. CCT programs, such as the ones we researched then, are delivering a strong message, reinforcing asymmetrical gender relations and women's traditional mothering role, which results also in confirming the exclusion of men from their responsibilities and responsibilities of care as well. There is some evidence that shows that these programs, unfortunately, in giving money to women, have actually meant that men give less money into the household. And I think that's one finding we have to be quite attentive to, because, again, the message is if you don't tackle gender relations and discuss that question, you leave inequalities untouched, and you're not going to reach the poorest and most vulnerable women or tackle their particular vulnerability. In the Andes, I think this slide actually is quite interesting from that respect. The bonos, the transfers, have actually come from government with quite strong maternalist discourse, as I mentioned. And in Bolivia, the bono was launched by President Evo Morales to mark the celebration of Mother's Day. Interestingly, some of the men we interviewed were not at all happy about the association with the president. One husband was reported as saying, "So you're married to the president now. He takes care of your children." So it's kind of interesting to see that gender relations are affected in very complex ways by these kinds of interventions, and that's another story which we'll be researching next time round. But there's no doubt that women's votes have been secured in many countries as a result of these bonos. Now, while maternity has made the focus of women's identities, very little, unfortunately, is invested in the mothers themselves. As present or future carers of infants and children, we know that improvements to women's income, health, and education have these multiplier effects on the family as a whole. Children's life chances are greatly improved when their mothers are educated and healthy. Policies aimed at empowering women, while morally justified in themselves, are generally also agreed, as we have heard, to serve wider social goals, including assisting general development efforts. It would therefore seem that both from a human rights and utilitarian perspective, we can see that this indicates that social protection policies need to be gender sensitive and to take account of women's needs and risks if they're to be effective in tackling some of the root causes of poverty and reaching the most vulnerable groups. Let us hope for more progress in this regard.